Welcome to the Nurse's Note, where we simplify nursing concepts with expert tips and practical insights. In today's video, we'll be diving into gastric ulcers, a common condition that affects many patients and can be critical if not managed properly. Understanding the causes, symptoms, and treatment options is essential for healthcare professionals. And in this video, we'll cover everything you need to know about gastric ulcers. A gastric ulcer is an open sore or lesion that develops on the lining of the stomach. It occurs when the protective mucous lining of the stomach is damaged by acid or infection, leading to painful open areas on the stomach's surface. It's important to note that gastric ulcers differ from duodenal ulcers, which occur in the first part of the small intestine. Both share similar causes but have different symptoms and locations. Gastric ulcers can be caused by a variety of factors, and it's important to understand these risk factors to prevent and treat the condition effectively. Some of the main causes include Helicobacter pylori infection. This bacterium weakens the stomach lining, making it more vulnerable to acid damage and leading to ulcer formation. NSAIDs, non-steroidal anti-inflammatory drugs. Medications like ibuprofen or aspirin can irritate the stomach lining and increase the risk of ulcer development. Excessive alcohol consumption and smoking. Both irritate the stomach lining and slow down healing processes, significantly raising the risk of ulcers. Stress. While stress alone doesn't cause ulcers, it can contribute to the production of stomach acid, worsening the condition in people already at risk. Genetic factors. In some cases, a family history of ulcers may make someone more prone to developing them. Gastric ulcers can cause a range of symptoms, some of which can be quite severe. Common signs to watch for include abdominal pain, often described as a burning sensation. This pain can occur anywhere from a few minutes to hours after eating and may get worse at night. Nausea and vomiting, sometimes accompanied by a feeling of fullness or indigestion. Bloating and an uncomfortable feeling in the stomach area. Blood in vomit or stools, which may indicate internal bleeding, a serious complication of gastric ulcers. Common diagnostic methods include endoscopy, a procedure where a small camera is inserted into the stomach to directly visualize any ulcers. Testing for H. pylori. A blood, stool, or breath test can help determine if the ulcer is caused by an H. pylori infection. Imaging techniques. X-rays or barium swallow may be used to assess the extent of ulcer damage. Gastric ulcers are treatable, and with the right approach, patients can recover fully. Loving this? Like, share, and subscribe for more. Treatment includes medications. Proton pump inhibitors, PPIs, help reduce stomach acid production, allowing ulcers to heal. H2 blockers also reduce acid production. Antibiotics are prescribed to treat H. pylori infection. Lifestyle changes. A diet that avoids spicy foods, caffeine, and acidic beverages can help manage symptoms. Smoking cessation and limiting alcohol are crucial in the healing process. Surgery. In severe cases, surgery may be required to treat complications like bleeding or perforation. If left untreated, gastric ulcers can lead to serious complications. Some of these include perforation. This occurs when the ulcer eats through the stomach lining, leading to a life-threatening infection in the abdomen. Bleeding. Ulcers can cause bleeding, which may lead to anemia or shock if not treated promptly. Obstruction. A scarred or swollen stomach from ulcers can block the flow of food, causing discomfort and vomiting. As a nurse, it's essential to monitor patients for potential complications, such as regularly assessing for signs of bleeding, like black stools or vomiting blood. Educating patients on the importance of medication adherence and lifestyle modifications, such as avoiding irritants like alcohol and smoking. Administering prescribed medications as directed and being aware of potential side effects. To summarize, gastric ulcers are a common yet serious condition that can be effectively treated with early diagnosis and proper care. By understanding the causes, symptoms, and treatment options, you can better care for patients and promote effective healing. Don't forget to like, share, and subscribe for more expert tips and educational content on nursing and healthcare. Let's keep growing and thriving together.